hour and a half ago, right before I left to come record this podcast, I was sitting with a new patient consult who had come to me with a scar on his face, on the corner of his eye, extending into his temporal region and into his cheek. He had a basal cell carcinoma, and it was an extensive one, and his surgeons cut it out, and they had plastic surgeons come in and reconstruct it with what's called a free tissue transfer, taking a large piece of tissue from his thigh and transplanting it to his face to cover the defect after having that cancer removed. After that, they took him to surgery again a couple months later and debulked it so it looked flat and smooth. From a technical standpoint, this gentleman had excellent surgery by his surgeons in that the scar is smooth and the scar is flat and it covered the defect. But you can see that scar from across the room. And he is totally unhappy. And he's gone now to 2 or 3 other plastic surgeons who have talked to him about options, including different types of laser. And he wasn't satisfied with that answer, and he came to see me. I have no idea why he came to see me, but he came to see me. And as he's talking to me, I'm saying to myself, there is nothing I can do for this guy. What am I going to tell him? And as I am thinking to myself, what can I tell him? All of a sudden, I realize what he needs. And he needs, what we all want with scars is we can't get rid of them. We want to hide them. We want to camouflage them. And what will help this gentleman more than anything else is paramedical tattooing. Today on Beauty and the BS, I have with me Jody Stoski, who is the founder and director of the Jody Stoski Paramedical Tattooing Academy. She is one of the foremost experts in paramedical tattooing and one who is so crucial for those people who have scars or other types of disfigurement that aren't amenable to surgery or aren't amenable to laser, but are so problematic for the individual who has them that they will try to find ways in which they can make it better and oftentimes have come to a complete wall. Jody is the type of practitioner who can help them, who can get them over that wall. So Jody, thank you so much for joining me today.
Thank you for having me, and thank you for that lovely introduction. I'm super excited to be here and chat about this subject, which I think is becoming more well-known, but still deserves a lot more light. And yeah, just the ability to be able to heal so many more people with this type of service.
Well, let's talk about it. I want to talk for a little bit about scars, but I know that this goes far beyond that. So many people, when they come to see a surgeon of any kind, they say, well, will I have a scar? And almost every time I have to tell them, yes, you will have a scar. The question is, what will the quality of that scar be? How visible will it be? And oftentimes, no matter what, that scar is going to be significant. And so finding ways that are not surgical that can camouflage it is a crucial tool for those of us who are trying to enhance people from an aesthetic standpoint. And I think all reconstructive work should be looked at from an aesthetic standpoint because we all just want to try not to, we're not so much trying to look so much better when we're dealing with reconstruction. We're just trying to regain what we had lost. But when you say tattooing, it brings different connotations to do so many different people. Obviously, there's the decorative tattoos that are very prevalent today, and there's cosmetic tattooing, which may or may not be similar to what we're going to discuss right now, which is paramedical tattooing. So as we get into it, do me a favor. Let's start from the beginning. Tell me about you. Tell me how you ended up getting into this field, and then we're going into the specifics of this field itself.
For sure. That's a great place to start because I know sometimes the definition between the two is a little gray. So I'm happy to be able to talk to that as well. But a little bit about myself. I am born and raised in Calgary, Alberta, Canada, and I have a family, 2 sons, Ryder and Lincoln, and amazing husband, Kevin, who actually now works with me on both of my business, which is Cinnamon Girl Clinic and the Jody Stoski Paramedical Tattoo Academy. So the Cinnamon Girl Clinic is my brick and mortar store here in Calgary, where I do all of my paramedical and cosmetic tattooing. And then, of course, the Academy is my online way of teaching other tattoo artists how to, bring paramedical tattooing into their business, understand the concepts and the techniques, etc. So, rewind back in time. I graduated in marketing, but I always had a taste for being an entrepreneur. That was very prevalent in my family. So I started out as a makeup artist while I was going through high school, and I was super creative. I like to draw and paint, but like a lot of girls, they're into makeup and fashion and beauty. So this was a really cool way for me to integrate that into, having a part-time job as a student. So not shortly after that, I actually began a makeup artistry business called Cinnamon Girl, hence where the name came from. And I did makeup for weddings, photo shoots, runways. I went back and forth to Europe for their shows, so like a spring summer shoot and then a fall winter. And as I kind of was doing that back and forth, it becomes a little bit much, right? Like you kind of take the rose-colored glasses off and realize like the jet lag and the traveling and all that stuff becomes a bit old. And Kevin and I were thinking about having children. So I was getting my eyebrows tattooed, and this was like back in the day where this was like an odd thing, but as a makeup artist, I realized the value in it immediately. So the person who did my tattooing was actually a physician from China, but couldn't come to Canada and practice medicine. So she started this business doing cosmetic tattooing and paramedical, and she approached me and asked if I would like to become an apprentice of hers. So that's how the whole thing got started. She ended up moving to Vancouver, and I followed her there and studied with her for about 4 years. So it was an interesting start for me because I had cosmetic and paramedical going at the same time, which is different and unique now because most people who get into this start off with that cosmetic background of tattooing. So we call that permanent makeup. So PMU for short. And so now there's this huge interest in paramedical tattooing. I think people are realizing not only how valuable it is, but like how unique it is. It's just one of those things that's a total showstopper when you can sit there and show someone's before photo with a huge skin graft on their face, and then their after photos, it's very tough to detect the scar. And like you had mentioned before, there's certainly a handful or more of patients that really struggle with the scarring afterwards. So even if they're, physically in tip-top shape, the residual scarring can be a huge conflict for, self-esteem and, even just triggering, I think, for them. So many people, those types of scars are related to illness or injury. So, depending on what that is for you, it can bring up some feelings for sure. So I graduated, did all my training, and then I opened up Cinnamon Girl Clinic in Calgary, and I started the cosmetic and paramedical tattooing. I opened up a clinic in a cancer center, which brought me a lot of people going through treatment and then people post-treatment, mostly through breast cancer. And what I did a lot of there was areola tattooing, so post-mastectomy, basically creating a 3D areola on top of a flat skin post-mastectomy, unless actual nipple mounds had been made. But either way, the secret sauce is the realism, the 3D. So from there, I kind of continued to grow, and within that required bigger space. And 3 years ago, actually this month, I opened up the Jody Stoski Paramedical Tattoo Academy. And that is how I now teach students to do what I do. And I have over 3,000 students in 41 countries. So I'm pretty proud of it. And it's cool just to be able to, know that other artists are out there being able to do the same things that I can. It's just, honestly, it's ridiculously rewarding.
So was there a moment, an aha moment for you, or something that happened that made you decide to shift from being a very successful and very busy professional makeup artist to going into paramedical tattooing, which is a relatively specific entity of the cosmetic tattoo industry itself?
I mean, I think as soon as I wrapped my head around what this was about, that was literally my aha moment of, I need to be a part of this. This is just like meant for me. But something that is, really makes a timestamp in my life is I was diagnosed with thyroid cancer, and I was young, it's not in my family, and that diagnosis came really super sudden. I mean, I think as it does for most. And at the time, I had my business out of the cancer clinic, which was, it was a blessing and a curse. The blessing was I had a lot of support, and I knew a lot of the doctors. The curse was that I knew too much. I had clients who were my age that had terminal cancer, who had been my clients and had since passed away. Like, I think for as much comfort as it gave me to have, that network around me, it was probably worse to just be so on the front lines of those were my clients. Like, that's what I saw and did every day. But I did end up getting a full thyroidectomy and was left with a significant scar on my neck. And I didn't think in that whole, scenario that I would have been left feeling self-conscious about the scar. And it turns out I totally did. When I realized that, after, I was healed up and walking around, and I think I was sort of feeling confident, but what rocked my confidence was seeing people stare at my neck, not my eyes when we were chatting. And that was how that developed. Like, I had no idea that was where my headspace would go. And then I really became on a mission to do on myself what I do to my clients. I was already taking good care of it, but then it became something different. It became something that was like affecting me mentally. And it sort of separated it from just, what I thought was going to be cosmetic. Like, yes, I want to make this scar look great. But now I'm thinking, oh my gosh, like, every time I'm out or I'm talking to someone, I'm feeling like they're staring at my neck. And I think the trickiest thing about that was that I felt like they were thinking, what did she do to herself? Did this girl try and cut her throat? Like, it's a weird spot for a scar. And that was just how my mind, I mean, I'm sure nobody even thought that was what happened, but that was how I was thinking. They were probably like, what in the world happened to this woman? So I camouflaged my scar. I did all the things that I do to my clients today, and returned back to my doctor and showed him, and him and his staff were just blown away.
Wait a second. You did this to yourself. You tattooed yourself.
I did.
That's very impressive because, for those of us who are going to be watching this on YouTube, you have better eyes than I do if you can see her scar on the camera, because I can't see it at all. So. Very impressive start.
Well, I forget that seems to be like a bit of a showstopper whenever I'm talking to people and telling them this story, because full disclosure, I've tattooed my whole face, my brows, my eyes, my lips. Moving on, and I try tons of things on myself, so I know how they heal. I kind of know what to expect, and it helps me improve my skills as an artist as well. So I've always been like a little bit of a canvas and a bit of a testing ground, so to speak. But, I always say, like, if you were a nurse, or even for you, if someone said, listen, you got to start an IV on yourself, like, it wouldn't be what you want to do, but of course you could do it. It's the same situation with where I was in. And back in the day, nobody knew how to do this. So it's like, hey, it's me or nobody. And, so that's how that ended up going. And I am now cancer-free and healthy, but my story is certainly something that's grabbed people's attention over the years. It's relatable, and it's pretty cool to see in real life.
It's a great story, and I'm so happy that the outcome is what it is. But I think your emotions are very universal for those people who do have scars. And as with the example that I was giving at the beginning of this podcast, this gentleman who's very appreciative that he's cancer-free right now, and he's gone through all this stuff, but he can't help but think that everybody's first impression of him is a scar, and everybody is noticing the scar and not him. And I think that for those people who have areas of scarring that are in the visible area, it's traumatic. And for those people who have scars or areas of normal anatomy that aren't there anymore, secondary to a mastectomy or other reasons, have a sense of loss that they are very emotional about, that this brings back a sense of self and a sense of confidence. So I think what this is pretty remarkable. But tell me the difference. Tell me the difference between cosmetic tattooing and paramedical tattooing.
Yeah, of course. So let's start with cosmetic. So in the realm of cosmetic tattooing, you would be seeing a permanent makeup artist, my PMU people, and that would include brows, eyes, and lips. When I say brows, you're creating a fuller brow. For me, what makes it amazing is it being undetectable. I think if you've been tattooed properly and it's your vibe as well, that's how you want it to look. The tattoo should be, only there for you, and if you choose to share it. It should be an enhancement. It should look super natural. And I mean, we certainly see the other end of the spectrum, of which it does not look like that. And that's not, what I'm a big advocate for, but to each their own. So creating, hair strokes and brows, it's amazing for alopecia. I mean, I can't explain to you as a man necessarily how impossible it is to do brows for women, let alone women that don't have hair. It's a big piece of real estate when you're trying to navigate getting something, symmetrical and that looks real. It is a huge thing, and it's like Groundhog Day for these people. It's like, wake up, try again, go to bed, wash it off, get up the next morning and do the same thing. So to be able to minimize that to, hey, come and see me once a year for a touch-up and wake up and go be waterproof, go on your holiday and put sunscreen on and go swimming and not worry about rubbing a brow off is huge. People come in all the time and say to me, oh my God, these have changed my life. And those aren't necessarily people who are ill. Those are people like you and me that has just made a huge impact on their confidence and the time that it takes them to get ready, etc. And then for eyes, we do anything from, what you would think of as eyeliner to a lash enhancement, which creates the illusion of thicker, darker eyelashes. And that's, again, very popular with my alopecia community. And that is both male and female. For those two services, I have a huge roster of clients that suffer from that. And I mean, that is, such a game changer for them. I wish that healthcare covered that for them. Like in Canada, you'll get a certain shitty small percentage to say, here, go buy a wig, when a good wig can cost $1,000 and they give you $200 or whatever. But it doesn't help you with any facial hair, which is a dead giveaway. I mean, you either look like, if you know what alopecia is, that may be that, or you think they're going through chemotherapy. So either way, it's tough. And then lastly, lips. So lips can be anything from looking like you just have a bit of color to a bit more. It's actually one of my super popular services because as we age, I'm sure the vermilion border starts to pull apart and we lose color. And we lose color in everything. We lose hair in our brows, our eyes, and then the lips start to fade out. So when you're putting that color back in, that's what creates the youth. That's what creates the illusion of, looking fresh and fabulous and 10 years younger. So that would be, the list of cosmetic. Now, paramedical is different because these tattoos are just straight up like a body tattoo. So we use a machine that you would use if you were a body tattoo artist. We use inks that you would use if you were a body tattoo artist. But these tattoos, the difference is these are undetectable tattoos. They need to be like invisible tattoos. They need to be a tattoo that, if we've succeeded, just blows people's mind when they say, hey, this is a tattoo. And those can be anywhere, literally from head to toe. There's very few things I haven't tattooed on people when it comes to paramedical, because literally the list is endless. The scars are never the same, and the canvas is never the same, which is why the training is different when it comes to, studying to be, a cosmetic tattoo artist versus, a paramedical artist.
I have to imagine that that's got to be extremely challenging, especially in areas of the skin that are exposed and that are scarred, because with decorative tattoos, they're going to stay one color all the time, and it doesn't really matter if your skin color changes. But to be precise and to camouflage a scar, let's say on the face, or where even if people are diligent about sun protection, you're going to see some changes in color. So how do you try? I can't imagine you can perfectly match when people's skins are changing, but how do you try and find that happy medium where they're going to have, sometimes their color's going to be a little bit different, and other times it's going to be spot on. How do you manage that?
Well, I think what ends up, the vision that you probably have is me picking up a color and then I'm going to tattoo it into the skin. And then could be these really inconsistent results, because you think of, like, if I'm going to guess, even if it's my walls are white and I got to go get a white paint, there's like a million shades of white, right? And if I got home and painted the wall white, it could be so obvious that never matched, right? The undertones, etc. But what is so cool about paramedical tattooing is we use multiple colors. And these colors are diluted down a fair amount, which allows the artist to think of it as a watercolor painting, right? If we were to use watercolor, we can get this like soft, brushy effect and blend and create sort of a different flow of art, versus if I were to use acrylic paint, where it's just like, boom, full color, full punch. And that is basically a paramedical tattoo artist nightmare, if that would be the result, because skin doesn't have that opacity. It has to, kind of ebb and flow. And in order to do that, that's why these tattoos require sometimes many sessions, sometimes maybe only 2, sometimes 5. But we're creating a piece of art essentially, and like layering tones upon tones to get something that looks really seamless and fluid. Because, even like our face, if I'm tattooing something on the face, like when blood pressure changes or you get up from laying down and standing up, it's like all of that color fluctuates. So it's never going to be perfect. But with paramedical tattooing, that's not the end goal. They want improvement. Yes, I want to get it to as close as perfect as I possibly can, but it's also what I love about these clients. Like, they're just often so thrilled with a minimal improvement. And, of course, I'm always going for that 100% result. But, once you have a lot of experience, you can better judge to say, hey, I think we can get this 70% better. Does that sound good to you? Or, hey, you know what? This burn scar, I'm going to be able to improve a small amount of texture and a bit of color. So maybe it's a 20% improvement. Is this worth it to you?
So let's talk about who it's indicated for. We talked a little bit about it before, but in your practice, give me the spectrum of those patients who come to you for paramedical tattooing.
We see all ages. Anybody under 18 in the province of Alberta, where I live, has to be accompanied by an adult. And those patients for me are more like alopecia, self-harm scars, sometimes cancer, but that would be kind of, the grouping of that underage market. And then beyond that, it's everybody. I work very closely with the transgender community. So, after a top surgery, getting everything looking more to, the more masculine or feminine side, depending on what they're going for, to, burn victims, all colors of skin from like Fitzpatrick 1 to 6. The only contraindications typically is if you're a keloid scar, because those it's like a landmine. You kind of can't predict it. I can work on them sometimes, and I'm very cautious to start off with a test patch and see how that goes, but definitely not something I teach or recommend to, someone newer.
So that's pretty broad spectrum. I mean, and it's so important. You see people who are, you talked about self-harm scars, and people who are cutters, and cutting is so much more prevalent than I think people realize until you have, a child in their teens, and then you start recognizing that it's there. Then you see people in their 20s, and if you've ever seen it before, then you recognize it on their arms, and it's always kind of a reminder to somebody who's just meeting them that, oh, this person has had some emotional issues. Worse, though, I think it's a reminder for those people who went through those emotionally hard times and found the need to cause self-harm, as a constant reminder. So having a way of muting that is a pretty remarkable thing to have. And I think that's something that I didn't know that was a possibility. I think that's a very, very good process to go through. Obviously, you talked about your nipple and areolar reconstruction for people who've had mastectomy, and you mentioned 3D reanimation with tattooing. Tell me about that. How do you get a 3D effect?
Well, we've all been out on a holiday, or maybe even your own city, where, there's been a street artist that's drawn like a huge hole in the sidewalk when there actually was never a hole there. And I think there's just something that is so cool about that our brains can just never quite wrap itself around to understand how that works. And that's what's so fun about those tattoos. So it is really about, a highlight, a low light, a midtone, and understanding where those highlights need to go, where those lowlights need to go. How does a breast age, and then how does that shape change? So, it depends on the age of the woman, the size of her breasts, and it's all art, right? You have a whole bunch of different colors to create, this realism, and of course the color palette is endless. And so, forming what looks like is protruding off of the skin when it simply isn't is the coolest thing. And I actually prefer it when people come in. I work in plastic surgery on Fridays doing these types of tattoos, and when a woman has opted to actually have the nipple mound made, in my opinion, I always feel like just the flat surface, like if they haven't done that, the 3D tattoo looks better. And the reason for that is because the nipple mounds don't age that well. Like they kind of tend to melt. So, you kind of have what maybe looks like, a decent looking nipple, and then over a few years it's kind of like a melted Smartie. And then that requires more art and work, because we now don't want this like blob of a nipple. We want to, create the illusion of something tighter and smaller. So it's like a whole bunch of more, low lighting and creating depth where there is no depth.
Yeah, I don't know if everybody knows this, but for breast reconstruction, when you're creating a nipple, which is to give the projection, the surgeon will create a very large nipple, and thinking that it looks way too large for the patient. And within a couple of months, sometimes even shorter, it becomes smaller and smaller to the point where it barely has any projection. You've gone through this whole procedure, but the amount of retraction or shrinkage that occurs is pretty significant. So when you can do this and get the beauty of a nice areola with the visual perception of the projecting nipple without that irregularity and inconsistency, I think that's a win for these patients, which is kind of a cool thing to have.
The other thing, just to add to that, is there's often symmetry issues that become tough for me to work with. So the healing process of that, although, the surgeon's, intent is for it to be perfect, it's like when that's a healed product, often I'm like, oh man, how are we going to make these look good? And it's that's holding me back. So, that's sometimes a bit of a complication. And then second of all, for a lot of women that did opt out. They're like, I just don't want to have one more surgery. Like I don't want one more thing. I don't need one more cut, nothing. So even when they're in that, I was kind of like, yes, perfect. Because now I can make this look incredible.
What are the risks involved here with this procedure or any type of tattooing?
Yeah, I mean, there's always, if you look back to, medical records and people who have, actually journaled about these types of scenarios, the risk would be a reaction to the ink. And I've done over 10,000 tattoos and never, knock on wood, have I had a reaction to ink. It's very uncommon. How that crept up back in the day was they had a red ink with a product, I think the ingredient was called Red 40, and the Red 40 in to make this color ended up being highly reactive in people's skin. So this would have been body tattooing, right? They would have been, hey, I got a strawberry on my arm, and then the strawberry's like bubbling up and doing weird things. So they removed that. You can't use that anymore in the market. But for the types of things that I do, I guess you would worry about infection, which, if you're following the protocol, it's at times like no more invasive than a paper cut. It is not rocket science to heal these properly. If you're, not going in a hot tub or doing hot yoga or going swimming or baking out in the sun, like it's common sense. And then the last thing, like I had mentioned before, is keloid scars. That's a big one. You also don't want to tattoo anybody pregnant. And yeah, that's kind of the top of my head, the big no-nos.
In decorative tattoos as well as cosmetic tattoos, and I'm sure with paramedical tattoos, sometimes you just get a bad tattoo. You get somebody who didn't do a good job or didn't turn out the way you want. I mean, look, that happens to everything in life. How do you take care of bad tattoos?
Well, it's $1 million question, to be completely honest. The person who figures out how to deal with that is going to be rich beyond their wildest dreams, because yes, there are some options. Do they work great? Is it a seamless, transition? Absolutely not. So if you have a bad body tattoo, your only real option would be laser. So, you're out in Vegas and you get a big mom tattoo on your arm and you decide that wasn't the sharpest move. So you come back, you're in for probably 10 or more treatments of laser, running you upwards between probably $1,000 and $2,000. So it's very expensive to try and go down a corrective route. When it comes, there's excision, of course, if that was possible. And there are definitely a lot of like snake oil type solutions that I see, like lightning creams and, whatever the internet might be able to provide us with. But again, none of those actually having any validity. And then for us, when it comes to a bad camouflage tattoo, so a bad camouflage tattoo is tricky because you're dealing with skin-colored inks that do not respond well to a laser. So what happens is the iron oxide in the ink will turn black upon a laser hitting it. So of course, that's not going to make anything look better, and that's certainly, a risk. There are certain ways of lightening them, but you just, honestly, you have to be really careful and you have to know what you're doing so you don't botch these things up. So, slow and steady for me, a lot of dilution so you're not putting too much ink and saturating the skin with that. In the future, hopefully they do come up with some better options for removal. It is very unfortunate, especially when it comes to injury or illness, and then you've just made that worse for them. When it comes to cosmetic tattoos, though, you'd be down the laser route for sure, and that tends to be pretty successful.
It does for cosmetic and decorative tattoos, or decorative tattoos, I should say. I want to distinguish between decorative, cosmetic, and paramedical. But as you mentioned, it is multiple sessions. There's never a guarantee you can get all of the ink out. Sometimes you'll get a halo or a ghosting effect of the ink. It's a lot more painful when you're having to do it over and over again than it was the first time when you were probably a little intoxicated getting it. But the thing that people need to know, as you mentioned, is the inks are a little bit different for the cosmetic tattooing, the permanent makeup tattooing, than with the decorative ink. And they, as you mentioned, may not just not respond, but may respond completely adversely and make it worse. So you've got to be careful. And lasers aren't necessarily an option for some of the tattooing that you're doing. Which brings me to my next question. How do you know who to go to? Is there any standardization of training? Luckily, I know you're doing this and training people. But how does somebody in Independence, Missouri, or Greensboro, Georgia, or Fresno, California, find somebody to do what you do and feel they do it with a sense of confidence?
Yeah, absolutely. Well, I think the answer to that question is to not only, be the person who's interviewing that artist and ask for their work before and afters. What does this look like aged? Have a consultation with them. For us, we have people fly all over the world. So if an in-person consultation isn't convenient, have a FaceTime consultation. And nowadays it's so accessible online to capture all their work in a portfolio. And for example, if you had a skin graft on your face, you'd say, show me some examples of skin grafts on the face that you have done. It is a little bit of the wild, wild west out there. I'm not going to lie. There are some pretty crazy things that happen. I know with our students, we have a study hall that they all come to and continue to learn and post all of their cases. So again, you're never really going to have the same situation twice, right? Which makes the learning curve a little steeper. But when you have a community of artists around you that share, it shortens that curve up and does allow you to become better faster and be in a safe place to share, because all of us have made mistakes in the past, and that's unavoidable. But to be somewhere that you could say hey, I did this, what do I do next, is really, really reassuring.
How much science and how much artistry is in what you do?
I mean, I would say it's mostly artistry, to be honest, because the science end of it's already evolved. There's no real change in that. I think the biggest change is in the surgical results, and then how, the different illnesses and injuries, those repair come forward. So for example, scars on a breast augmentation can look so different today than they did 10 years ago, right? So that, more the science and the medicine end of that is certainly significant, and not something that you necessarily need to know a lot about to be a good artist. But I think for me, it's important to me also because I teach, and I want to know as much as I can to be able to, not only for myself, but for my clients. And when they've been through something and they're telling me that they're still on tamoxifen, I can say, well, you're probably not going to get your brows back, because even though it says it's not a side effect, tamoxifen really stunts the growth of your eyebrows. And so for me to, it gives people confidence in you. You want to know as much as you can. So I think it's more art, to be honest.
Is there a network where someone can go and say, I live in this part of the United States, or I live in this part of Canada, or this part of Europe, where they can find someone who has that skill set?
It's funny, there's for me and working with the transgender community, it exists in there, which is interesting. So I would be on their resources of people that would be she knows what she's doing. This is a safe space. I also happen to train in it, so I think that gives them a little bit more confidence. But to say hey, is there an academy or, a college that we could go to see, if this person is legit, or how do I find them? It doesn't exist yet. It is in the making for sure. And as, this grows and gains popularity, I think that will be something not only that is important, but that will be there.
Do you see technology changing the field in the next 5 or 10 years?
You know, tattooing's been around for forever, right? And that really hasn't changed significantly. I think the improvements come from needles, needle technology, from inks, becoming better, from even things like aftercare becoming better, or, the ability to say lighten or remove. I think those will be the advancements. When it comes down to the real bones of it, I don't know how much will change. You really just still need a warm body with a creative mind to execute the things that we do.
So if you go to see your doctor and your doctor says there's nothing more I can do about your stretch marks or your wrinkles or your acne scarring or certain types of birthmarks or skin graft scars or burn scars or other types of elective surgery scars, there is somebody to go to, and there is an answer to that. It's not an eraser, but it is a helpful tool. And Jody Stoski, thank you so much for educating me and educating our audience on all things involved in paramedical tattooing. Tell us how we can find out more about you and the Jody Stoski Paramedical Tattooing Academy.
Yeah, you can find me at jodystoski.com. You can find me on Instagram there, TikTok, and even just my website if you want to see what I do.
And I recommend those of you who get a chance, look at her website. It will be very impressive and very encouraging. Jody, thanks so much for joining us today.
Thank you for having me, Peter. It was awesome.
Look forward to talking to you soon. And that's it for this episode of Beauty and the BS. Thanks for joining us, and we look forward to having you back on the next episode. See you soon. The Beauty and the BS podcast executive producer is me, Dr. Peter Grossman. Our producers are Max Banta and John Largent, and editing and post-production services are provided by Game Day Media. You can listen to Beauty and the BS wherever you listen to your favorite podcasts. And if you would like to leave a comment or ask me a question, go to beautyandthebspodcast.com and click on the microphone icon, and we may use your comment on a future episode. You can also find our archives, video clips, and more on the website as well. Thanks for listening to Beauty and the BS with Dr. Peter Grossman.